Hey, stop what you're doing right now, because what I'm about to share with you could genuinely save your life or the life of someone you love. And I don't say that to frighten you. I say it because most people who have a heart attack never saw it coming. Not because the warning signs weren't there, but because nobody ever taught them what to look for. I'm Dr. Aiden, interventional cardiologist, cardiovascular researcher, and author. I've spent over 28 years studying how heart attacks happen at the physiological level, not just in the hospital, but in the weeks and months before anyone calls 911. And what I've found, confirmed by a landmark 2021 study from the European Heart Journal, following over 94,000 adults across 17 countries for 22 years, is that up to 79% of heart attack victims experience clear, identifiable warning signs in the 30 days before their cardiac event. 79%. They just didn't recognize them. And their doctors in many cases didn't ask. Today I'm going to walk you through the 5 most critical hidden warning signs, ranked from commonly overlooked to the one that the cardiology world is now calling the silent predictor, because by the end of this video you will know what to watch for, what to do, and what to tell your doctor before it becomes an emergency. And I want to tease something right now, because number 1 on this list is a symptom that 85% of people, including many general practitioners, consistently misattribute to something completely harmless. And missing it could be the most dangerous mistake of your life, so do not skip ahead. Watch this to the end. The order matters. Each sign connects to the next. But before we get into it, I want to ask you something personally. Leave a comment below telling me your age. And this: has a doctor ever sat down with you and talked about heart attack prevention, not just cholesterol numbers? I read every single comment on this channel, and your answers shape exactly what I cover next. Take 10 seconds and share. Now let's get into it, starting at number 5. Number 5 is a symptom so ordinary that virtually everyone ignores it. And that ordinariness is exactly what makes it dangerous. I'm talking about unexplained fatigue. Not the tiredness you feel after a long day, but a deep, persistent exhaustion that arrives without a clear reason and doesn't go away with rest. Now, before you dismiss this, hear me out, because the mechanism is directly connected to how your heart handles stress under the surface. When coronary artery disease begins to develop, your heart muscle starts receiving less oxygenated blood. It compensates. It works harder. And that compensation quietly drains your body's energy reserves, sometimes for weeks or months before any chest pain appears. A 2018 study from the American Heart Association found that 71% of women who suffered a heart attack reported experiencing unusual fatigue in the weeks prior. Many described it as feeling like they simply couldn't recharge, no matter how much they slept. And here's what makes this especially critical for people over 55. After the age of 60, something called cardiac reserve declines. That's your heart's ability to ramp up its output under demand. Think of it like a car engine that's been quietly losing horsepower for years. It runs fine on flat roads, but the moment you hit a hill, it struggles. The fatigue you feel is often your body's way of telling you the engine is under strain. Here's what to watch for. If you're experiencing fatigue that feels different from your normal tiredness, heavier, deeper, unrelated to activity, and it has lasted more than 2 weeks, is a conversation you need to have with your cardiologist. Not your general practitioner, your cardiologist. Synergy tip for this one: track your fatigue alongside your resting heart rate every morning before you get out of bed. A rising resting heart rate combined with unexplained fatigue is a combination that should never be ignored. A simple fitness tracker can do this for you automatically. Number 5 is the foundation. But what's happening in your body while you sleep could be an even louder alarm bell. Let's talk about number 4. Number 4 is a symptom that billions of people experience and almost universally explain away. It has been studied in over 800 peer-reviewed papers, and cardiologists now consider it one of the most underreported predictors of a cardiac event in adults over 50. I'm talking about sleep disruption, specifically waking between 2 and 4 in the morning with a racing heart, shortness of breath, or an unexplained sense of unease. In 2022, researchers at the Mayo Clinic published findings showing that adults who reported frequent nighttime awakenings accompanied by heart palpitations had a 63% higher likelihood of a significant cardiac event within 18 months compared to those who slept undisturbed. 63%. That is not a minor correlation. Here's the mechanism. During the night, your autonomic nervous system shifts into parasympathetic mode, rest and recovery. But when coronary circulation is compromised, your heart can struggle to maintain rhythm during the reduced activity of sleep, triggering micro-arousals that wake you without an obvious cause. Most people blame stress, they blame indigestion, they blame getting older, and they go back to sleep. I had a patient, David, 58 years old, from Houston, Texas, a construction manager who came to me complaining of poor sleep. He was waking at 3 a.m. almost every night, heart pounding, slightly breathless, then fine within minutes. His GP had told him it was anxiety. When I ran a full cardiac workup, we found a 74% blockage in his left anterior descending artery, what cardiologists call the widowmaker. We intervened in time. David is now 61, running 5Ks and coaching his grandson's football team. He told me, "I almost wrote it off as stress." He almost did. Synergy tip: if you experience nighttime awakenings with heart palpitations, start keeping a one-line journal by your bed. Note the time, what you felt, and how long it lasted. Number 4 is serious. But number 3 is where the science becomes truly extraordinary. And if you're finding this valuable, this is a good moment to hit that subscribe button and give this video a like. I release evidence-based cardiology content every single week, and your support is what makes that possible. Synergy tip: if you experience nighttime awakenings with heart palpitations, start keeping a one-line journal by your bed. Note the time, what you felt, and how long it lasted. 3 or more occurrences in a week is your threshold to seek a cardiac evaluation, not next month, this week. Number 4 is serious, but number 3 is where the science becomes truly extraordinary. And if you're finding this valuable, this is a good moment to hit that subscribe button and give this video a like. I release evidence-based cardiology content every single week, and your support is what makes that possible. Number 3 is something you've almost certainly experienced, but I promise you haven't heard it connected to heart disease in this way. And the way most people explain it away could be costing them their lives. I'm talking about jaw pain, left shoulder ache, or upper back discomfort, not combined with chest pain, but completely on its own, with no chest involvement whatsoever. Here's the science. Your heart shares nerve pathways with your jaw, your left arm, your upper back, and even your upper abdomen through a process called referred pain. When cardiac tissue becomes ischemic, meaning it's being starved of oxygen, the pain signals travel along shared nerve routes and surface in completely different parts of your body. Your brain, quite literally, gets the address wrong. A 2020 study from the Journal of the American College of Cardiology found that 42% of heart attack patients whose events were initially missed by emergency physicians presented with isolated referred pain, no chest pressure, no classic symptoms. They were sent home. Some of them didn't make it back. And here's the aging-specific biology that makes this so critical. After the age of 65, nociceptive sensitivity, your ability to accurately feel and locate pain, declines by approximately 30%. Your brain becomes less reliable at correctly mapping the source of cardiac distress. This means the classic crushing chest pain that everyone expects becomes less likely, not more, as you get older. The signs get quieter and more misleading precisely when the stakes are highest. Think of it like a fire alarm with a faulty speaker. The fire is real, the alarm is going off, but the sound is coming from the wrong room. Synergy tip: if you experience unexplained jaw tightness, left shoulder heaviness, or upper backache, especially during or after physical exertion, sit down, rest, and monitor for 5 minutes. If it eases with rest, that is a cardiac pattern. Call your doctor that same day and use the words possible cardiac referred pain. Those specific words will get you seen faster. Number 3 is remarkable. But the next 2 are where things become genuinely life-changing. Number 2 is a symptom that most people experience at some point, and almost nobody connects to their heart. And the research on its predictive power in adults over 50 is some of the most urgent science I've encountered in nearly 3 decades of cardiology. I'm talking about sudden, unexplained shortness of breath during activities that never used to wind you. Walking upstairs, carrying groceries, getting up from a chair. Here is why this matters so profoundly. Your heart and your lungs are in constant communication. When the left ventricle, the heart's main pumping chamber, begins to weaken, fluid backs up into the pulmonary circulation. Your lungs effectively begin to fill slowly, gradually, quietly. The result is breathlessness that creeps up on you so gradually that most people adapt to it without realizing they're doing so. They take the elevator instead of the stairs. They slow down on walks. They sit more. They call it aging. A landmark study from the Framingham Heart Study, the longest-running cardiovascular research project in history, now spanning over 75 years, found that unexplained exertional breathlessness was present in 68% of patients diagnosed with early-stage congestive heart failure. And in 54% of cases, it was the only symptom present for more than 6 months before diagnosis. Think of your heart's pumping capacity like a sump pump in a basement. When it's working properly, the basement stays dry. When it starts to fail, water quietly accumulates, slowly at first, then faster. By the time you notice the flood, the pump has been struggling for a long time. I want to tell you about Patricia, 64, from Birmingham, a retired schoolteacher who came to me after her daughter noticed she was stopping to catch her breath, walking from the car park to the supermarket entrance. Patricia had been attributing it to weight gain and age for over a year. Her echocardiogram showed an ejection fraction of 38%, significantly reduced cardiac function. We started her on a structured treatment plan. 18 months later, her ejection fraction had recovered to 54%. She walked her daughter down the aisle at her wedding last spring. She told me, "I thought it was just what getting older felt like." It wasn't. Synergy tip: do a simple monthly stair test. Pick a flight of 12 to 15 stairs in your home. Walk up at a normal, comfortable pace. If you arrive at the top noticeably breathless, if that breathlessness is worse than it was 3 months ago, that is clinical information. Write it down with the date. Bring it to your next appointment. That single observation could change everything. This is number 2, and it is critical. But what I'm about to share with you for number 1, the single most overlooked hidden warning sign of a heart attack. This is what the research has been quietly pointing toward for decades, and what most health conversations never reach. This is the one. Number 1 is a symptom, but I want you to hear it as a system, because what I'm about to describe isn't just a sign of a heart attack. It is your cardiovascular system sending you a distress signal in the only language it knows. Number 1 is something researchers now call autonomic dysregulation syndrome, a cluster of subtle, seemingly unrelated symptoms that together form the clearest picture of impending cardiac crisis that medicine has ever identified. And the data on how frequently this cluster is missed is frankly devastating. Here's the mechanism. Your autonomic nervous system governs everything your heart does without your conscious input: your heart rate, your blood pressure response, your vascular tone. When coronary disease progresses to a critical threshold, the autonomic system begins to lose its ability to regulate these functions smoothly. The result is a specific constellation of symptoms that appear in the weeks before a major cardiac event. These symptoms are a persistent feeling of doom or unease that has no psychological explanation, episodes of sudden cold sweating without physical exertion, a new and unusual sensitivity to temperature, particularly feeling abnormally cold in your hands and feet, lightheadedness when standing up that is getting progressively worse, and a subtle but persistent nausea that comes and goes without digestive cause. Individually, every single one of these symptoms has a benign explanation. Together, they are a 5-alarm fire. A comprehensive analysis published in the journal Circulation in 2023, drawing on data from over 200,000 cardiac patients across 11 countries, found that patients who reported 3 or more of these autonomic symptoms in the 30 days prior to their heart attack had an 81% predictive correlation with major cardiac events. 81%. And yet fewer than 12% of those patients had reported these symptoms to a physician. Think of your autonomic nervous system like the electrical grid of a city. Individual outages, a flickering light here, a blown fuse there, seem minor and unrelated. But when multiple districts start losing power simultaneously, an electrical engineer knows the problem isn't local. The problem is at the source. I had a patient, George, 67 years old, from Texas, a retired civil engineer who came to me not because he thought something was wrong with his heart, but because his wife had dragged him in after noticing he seemed not himself for 3 weeks. He had mild nausea that came and went. His hands were unusually cold. He'd been waking with a vague sense of dread he couldn't explain. His stress test was borderline, but his coronary CT angiogram revealed 89% stenosis in 2 vessels. We took him to the catheterization lab within 48 hours. His wife later told me, he kept saying it was probably nothing. It was everything. To protect yourself, do these things without negotiation. If you experience 3 or more of these autonomic symptoms simultaneously for more than 1 week, do not wait for your next scheduled appointment. Call your cardiologist's office and use these exact words. I am experiencing multiple autonomic symptoms, and I would like a cardiac evaluation. Those words carry clinical weight. Use them. Your synergy tip for this one: share this video with your spouse, your adult children, or whoever spends the most time with you, because autonomic dysregulation often shows up in behavior and appearance before the person experiencing it can articulate it. The people around you may see what you cannot feel. George's wife saved his life. Yours might save yours. All of the studies referenced in this video are linked in the description below. Read them. Print them out if you need to. Bring them to your doctor and ask the questions that a 10-minute appointment rarely leaves room for. Here is what I want you to hear as we close. A heart attack is not a sudden event. It is the final chapter of a story that your body has been trying to tell you for months. The signs are there. They speak quietly. And now you know how to listen, whether you are 45 or 80, whether you've had a cardiac scare or never given your heart a second thought, whether you're watching this for yourself or for someone you love. This knowledge belongs to you now. Use it. These 5 hidden signs: unexplained fatigue, nighttime cardiac awakenings, referred pain in your jaw and shoulder, exertional breathlessness, and autonomic dysregulation, are not exotic medical mysteries. They are your body's emergency communication system. And every single one of them is a window of opportunity, a chance to act before the crisis, not after. Don't let anyone tell you the symptoms aren't serious enough to mention. The research says otherwise, and so do I. If this video helped you, please subscribe to this channel and share it with someone whose heart you want to protect. Every week we go this deep into the science of cardiovascular health, and your support makes that work possible. And now I want to hear from you. Which of these 5 signs surprised you the most? And have you or someone you love ever experienced one of these symptoms and written it off as something else? Leave your answer in the comments. I read every single one.